My name is Claire Gasamagera. I'm from Rwanda, Africa. I'm a resident of United States in the state of Michigan. My parents discovered that I was HIV positive when I was only 5. I am a board member of the International Community of Women Living with HIV in North America. I am currently founding a community-based organization of immigrants living with HIV. The non-profit is called ARISE, which stands for AIDS, Refugees, Immigrants, Survivor of Human Trafficking, Engage in Ending AIDS. I'm currently a key correspondent for the International AIDS Alliance. I have served as a member of the Community Program Committee for the International AIDS Society from 2011 to 2014. I have founded and initiated a community organization for young people living with HIV in Rwanda. I have served as a youth representative for the UNAIDS High-Level Commission on HIV Prevention. I have served as a youth representative and leader in the UNFPA consultation on ICPD beyond 2014. ICPD stands for International Conference on Population Development Program. I have served as a member of the UNAIDS Positive Women Dialogue platform. I worked as a member of different steering committee in government and non-government organization in my country. I worked as a youth consultant in the development of the policy on sexual reproductive health for adolescents and young people. I'm pleased to talk about the upcoming United Nations General Assembly plan that is going to replace the Millennium Development Goals. I would like to make some comments on how young people should be involved. The MDG 4, reducing child mortality, and MDG 5, improve maternal health. They will be combined to be goal number 3, with maximizing healthy lives and achieving well-being for all. How are we going to achieve that? We need government leaders and donors to increase funding for youth-led organizations, working on poverty reduction, youth empowerment, and sexual reproductive health. We need to ensure that government leaders and donors increase funding to meet sexual reproductive health rights and needs of young people, and consider young people in all their diversities. We need to ensure that young people are meaningfully involved in the development, the design, the implementation, the reporting and monitoring and evaluation of projects related to sexual reproductive health and rights. We need to make sure that leaders and donors understand that it is crucial to ensure that young people are involved in plan and policies development for environment protection and preservation. MDG 6, combat HIV and AIDS, malaria, and other disease. The world leaders and donors need to fully understand that young people constitute the face of HIV and AIDS. And young people living with HIV are missing faces when it comes to HIV and AIDS prevention, treatment, and care support programs. Young people aged 13 to 19, young people aged 20 to 26, senior youth aged 27 to 34 are not leaders of tomorrow. They are leaders of today when it comes to matters that are affecting them. Young people know better what is important to them. They don't need representative and advocate to matters on sexual reproductive health and rights. They just need to be empowered. Ending AIDS means that world leaders and donors ensure that young people living with HIV in their diversity are meaningfully involved in all AIDS programs. Ending AIDS means ending HIV and AIDS-related stigma, hate, discrimination, and criminalization law and policies. We need to make sure that the world understands that HIV criminalization laws are impacting negatively the efforts and accomplishment made to end HIV and AIDS. Ending AIDS means increasing funding for youth-led initiatives, youth development projects, and meeting youth sexual reproductive health and needs. Ending AIDS means leaders and donors are willing to commit and increase funding for ensuring universal access to antiretroviral treatment to all people living with HIV. Ending AIDS means ensuring HIV prevention of mother-to-child transmission by involving young women living with HIV at the table of decision making when it comes to their health and to the health of their newborn. We need pharmaceutical companies to involve women living with HIV in the manufacturing of medicine when it comes to prevention of mother-to-child transmission. My closing remark. It will take time to tell whether young people living with HIV have hurt or helped the world. It will take time to tell whether we've made an impact on the fight against HIV and AIDS. But I believe that it's obvious that we will not leave the fight against HIV and AIDS where we found it. I believe that we are leaving a legacy that AIDS didn't defeat us. I believe that we may leave the end of AIDS and we may not. However, AIDS did not define who we are. AIDS did not define our dignity. AIDS did not defeat us. Thank you.